The Ocala is a regional health information organization that is working to join together the healthcare community through health information technology. Electronic health records are a digital version and database of medical information on the patients that we as providers care for. Essentially, it replaces the paper chart with a database that's electronic and hopefully will incorporate many more database savvy tools that will enable us to make much better use of the medical information that is available to us today and is also required for us to maintain better care of our patients. So the other part that we're looking to do is working with the medical society to enhance the information available. So there are many health IT resources that can be utilized by a practice, not just their practice management or their electronic health record. The overview is that we are engaging providers and patients with new technologies that will enable them to better communicate and have better access to the medical information that's required to produce good quality care for the patients here in Greater Ocala and Marion County. We're working with a number of vendors to get physicians electronic health records, and we're working with patients to get them online personal health records. The end result is going to be better access to the information that we need as providers to take care of the patients and allow the patients more transparency in their care and more ability to be involved in the decision-making process. So we have small employers, we have large employers, there's people from the school board, there's people from city and county government, as well as other businesses, plus then you've got the healthcare and the healthcare related fields that are all coming together to say how can we better serve our community by providing a more connected healthcare system. And that social capital is, I think, what's key to bringing our group together and create solutions that will work for everyone. In fact, the plan is that by creating a central hub of information, we should be able to provide those that have existing electronic health records a single connection to the entire community. We're working to create these interoperable opportunities, not only within a practice, but between practices and between providers and patients and between the hospital and the provider, so that there's fewer medication errors, so that there's less duplicated tests, so that there is better access to the information at the point of care. For example, when you show up in the emergency room doctor is then going to have information available from a primary care office or the last specialty office that may have only happened yesterday, and they're not going to duplicate or they're not going to take a person down the wrong path because they didn't have information that would have otherwise made them make their decision differently.
Taylor College's role is, as a local training support, is that our team of trainers will be training the physicians in their practices here in our county. And they will be the support by being long-term support, by assisting them with their faculty or anything that may need some additional training. Because we feel that when people have this experience, when they go out into the workforce, in our local workforce, and as you as a physician and your staff, when you're looking at resumes, because you have a position open, when you see someone with a resume who's very qualified, well, if one has full training already in place on the system, on the EHR that you are using, I think that would make you want to gear toward them.
The data is all located in one place. If somebody needs it in the front office, they can get it right away. If somebody needs it at the same time in the back, they can get it right away. So all the looking for data, the seeking lost data, the trying to find things that are missing, all of that goes away. There are sets of meaningful use measures that are actually scheduled to come into place in 2011, 2013, and 2015. And there are incentives tied to those that total out to $44,000 per physician over the 3-year period if those are met. Will allow the data to be gathered that needs to meet those measures and the reports to be made. The biggest issue is there's an actual cost of doing a paper chart and a time to do a paper chart. And that can be significant amounts of time. Most of the time it looks like it's running anywhere from 20 to 30% of all the revenue being brought into the practice is being tied up in the paper charting system. So The process analysis may let us reduce that by anywhere from 30 to 60%, which means we can either take time off or we can add extra patient visits, which of course bring more revenue into the practice.
And our patients will be able to manage their own health. They'll be able to view their information. They'll be able to talk to their physicians and their healthcare providers. Healthy Ocala is unique in that it is really patient-centric and it's also community-based. So our physicians, our communities, businesses, hospitals, healthcare providers, and patients have worked together to make a truly workable system for an electronic health record. We are not partnering with an insurance company. We're partnering with the patient and the physician and the healthcare providers. Right now we are doing pilot enrollment for Prestige 55 for volunteers, and to be able to put patients through the system. Eventually our patients will be able to enroll in the physician offices and in other sponsor agencies like their churches and the schools.
In order to purchase the electronic health records, the Greenway team would have to come into your office and evaluate. But what we've done is we have contracted with Taylor College and paid for their training with a federal grant. And so we will have local training that will come down to your office, and the cost is greatly reduced. You do not have to pay for the Greenway training all at once. What they need is, once they've given you a figure, we need a deposit to be put on there, and then they will bill you as the rest is incurred. What I'll do is I'll work with each physician on a one-on-one basis, reviewing their financial picture and reviewing funding options. But please do not turn away from the electronic health records because of financing, because that's something that we can overcome.
When you ask, will it save a life? Absolutely. An exciting thing will be when a patient may travel out of our area and they show up in an emergency room after they were just discharged from the hospital a week ago. All they need is to ask for an internet access, and they could log into their own personal health record, bring up their discharge summary from one of our local hospitals a week ago, and those providers would know everything that had just happened to them. If that physician in that other state would have access to their information and know that they had recently had a cardiac workup and that these tests were unnecessary, yeah, it could save a life.